Hey guys, so this video is going to help to kind of bring together what to do the week before the test. And this could apply to any class. I teach in the adult med surg class. It could be applied to other classes as well, but every class is a little bit different. But there should be some good principles in here, regardless of what class you're taking, in order to best prepare for an exam. Because these are just general tips and steps and study strategies. So what's different about the week before the test? The week before the test, everyone's a little different. In their studying pattern, some people save a lot of studying for the last week of the test. Some people have gotten a lot of studying done. It kind of just depends on a lot of circumstances, but it's good to know what to do right before the test because that's some valuable time. How can you best use your time that last week? So if this is your first test, keep in mind about expectations. The first test is always the hardest because you don't know what to expect. You don't know what the test is going to be like, what the questions are going to be like. And every class builds upon each other where, you start to kind of get to know what kind of questions, but, depending on the class and stuff like that, it might be a little different. So the first test is always kind of a crapshoot where you're trying to figure out what is this, class going to expect of me. You should go in probably thinking I'm not going to do as well as I normally would. And that's okay. Like not sitting here and saying, oh my God, if I don't do well on this test, I can't be successful as a nurse. Expectations are resentments waiting to happen. So expect to show up and just be as prepared as you can and learn with every exam instead of seeing it like I have to be successful and get an A on every exam. Go in and see what can you learn from each exam to continue to grow and move forward in your beautiful career as a nurse. So where do you start? Where do I start? Like, if I'm trying to, what do you call it, get prepared for a major exam. If you have not already, if you're one of the people maybe has left some of the reading for the end, do a basic skimming or reading of the chapters. I have another video called How to Read the Textbook, and it kind of talks about how to do that. And I have some stuff on my Google Drive that will documents and stuff that kind of talk through how to do that. But doing a basic skimming or reading, I have not heard of any classes in this program that you can get away without reading the textbook, at least at some level. Some of them are going to require more reading than others. But especially if you're in the adult med surg class, you don't have to have the book memorized, but you need to have some basic skimming or reading done for the book in order to move forward. So another question to ask yourself is, have you done any practice questions? And that would be the EAQs, et cetera. There's a variety of questions, question options out there. And if it's not the EAQs, like maybe you use a different service, maybe you use some from my Google Drive, maybe you have, a different, what do you call it, test bank or something that you really like. It doesn't really matter, but just have you done any? You don't have to do 1,000. There was a semester that I kind of kept a view of my students and and other students as well. And I kind of was just looking and there's some students that did like 2,000 questions and they got good grades. There's some students that did 2,000 questions and didn't pass. So, it just kind of depends on you. The questions are not, these two things, they're not going to save you. I'm not saying, hey, basic skimming of the book, do some practice questions and you'll be fine. But these are some key core things that you have to not only just, have the basic knowledge, kind of have the basic principles around the topics that you're learning, but you also have to have applied it or worked through it in some situations. Keep in mind that tests are not testing your knowledge, they're testing your ability to critically think. So you have to know some of the situations and what reading and some practice questions are doing, and they're helping to kind of bring forward some key points. What are some things that are going to have happen? So if all you've really done before the exam is been to lecture, taken notes, and then just read over those notes, it's usually not enough. There's very few classes and few people that can just go to lecture and read their notes, and then that's enough. You have to start taking this information and start applying it to situations. And the last week is a great time to start applying it. So let's talk about how to tackle practice questions. When you're doing practice questions, especially that last week, what you want to be doing is looking for clues in the question to connect or visually like see this patient, to visualize this patient. Even if you know the answer quickly, try to pause and talk through why the other answers are wrong. The more you understand, this is going to sound weird, but the more you understand what is wrong, the more you can figure out what's right. So in other words, it's great to know like, hey, insulin, aspart, I need to feed them within 15 minutes. Cool. It's great that you know that. But how about the other answers? Which ones do those apply for? If you know why the answers are wrong or really understand it, that just shows how much more that you can apply it to other situations as well. Um, what do you call it? So do some practice of just reading the question is a great way to go about it. Do you really know what the question's asking you? So this is a common misconception about why students are not successful, is that they think that there's, they don't understand why they're getting questions wrong. And a lot of times I'll look at it and it's like, man, they chose an answer that they must not have read the question right. So it's really great to take time when you have it while you're studying this last week to not even try to answer it, just read the question. Do you understand what it's really asking you? And try to rewrite it in your own words if you can, like to make it so it makes sense to you. I know on your actual exam, you won't have time to do this, but if you do take time to practice this, the better you're going to get it. The more you practice reading questions and kind of knowing what situations are going to come up, becoming familiar with unfamiliar words, especially if English is not your first language, the better off that you'll be. So you need to practice as much thinking as possible and as much putting yourself in scenarios as possible. When you're looking at answers, focus on concepts rather than trying to create a rule or memorize. So in other words, let's say you're looking at a question and saying like, okay, for this question, maybe it's like a respiratory question and saying, hey, what's going to help to like a patient, like for airway clearance or something for pneumonia. And so maybe the answer is like doing chest percussion therapy or like, kind of getting stuff up. If you create a rule in your mind, you're like, hey, the thing I'm going to do for this is always going to be this, then you're going to get locked into that. And to be a good nurse, you really need to have flexible thinking. You need to be able to kind of know what are the general principles or things that are going to help. So in other words, looking back at that question, instead of sitting there in your head and being like, oh, chest percussion therapy is the answer, is being like, hey, it's asking how I'm going to get mucus up. What kind of so one of my goals for pneumonia is to get mucus up. There's more than one way to get mucus up. So I'm kind of thinking about that, thinking about those general concepts. Sorry, my Alexa's talking. Hold on a sec. Alexa, stop. Sorry, I got her all excited. And so really focus on the concept behind the question rather than trying to like create a rule or memorize. Like when you're looking at these questions, don't sit there and be like, oh my God, I got to take crazy notes and write down like every last thing. Really be thinking about, okay, what's the overall picture here? What's the concept behind this question? What's the overall thing? So like for that last one, I'd be like, hey, with pneumonia, it's really important that they get sputum up because they have all the sputum and we need to get that bacteria and infection out. And so that's really the goal overall there. And hey, one thing we can do is the CPT. And then that's a good time where you could actually sit there and start to think about, well, what else could we do? What else would help to get that sputum up? And if you're ever doing a practice question and doesn't make sense, send it to your professor. Most of them are going to probably be open and willing to look at that question and tell you if it's something that just doesn't, two and two is not going together. So what else can we do? I said the key here is to practice application or to practice scenarios and stuff like that. So a great place to start is case studies. So case studies are not, I'm not talking just about actual practice questions, but scenarios. And you're not doing these just to complete them, but start thinking about what kind of situations could happen with different patients. So what situations do you need to prepare for? So let's say, for example, your topic is diabetes. I need to prepare for situations where their blood sugar goes high, where their blood sugar goes low, where they're having chronic complications, where they're taking medications. Like I need to prepare for all of these situations. Try to do case studies without your notes, especially if you're in this last week. You should always do the case studies without your notes, but you can write little notes to yourself as you go along, kind of pick apart like what meds are coming up, what situations are coming up. And don't just try to answer the question again, kind of take those strategies from the last slide and really try to look at the questions and try to think of what answers are right or wrong. And like, what's going to help. So again, the more you know what's wrong, the better that you'll understand what's right. So what else can you do? You can look at a few other things that you can do if you have not yet, and these are great to do the week before the exam. Have you tried talking out loud to someone else about these disease processes? No notes. I'm just talking about it, just sitting there and, saying like, hey, to your brother, sister, mother, father, whatever, hey, we called, let me tell you about pneumonia, let me tell you about this, whatever it might be. And that's going to really help you to really see where you're at. There were so many times before I started teaching that I really thought I knew information well, but then I would be standing up in front of the class. Someone would ask a question, or I'd read something from a slide and I'd be like, what in the world is this talking about? Like, I don't know. And like, hope no one asks a question. I was like, oh God, like I thought I knew this. What I would do is I would take a little note and I'll be like, I need to learn more about this, or I need to reread this or figure something out. But a lot of times I didn't realize it till I was actually trying to teach it. And there were times that I would literally look at my PowerPoints right before and I'd read it and say, that makes sense. That makes sense. And I'm sure you guys can relate. There's probably been times that you've been sitting and reading your textbook and you're like, oh my goodness, this makes perfect sense. Got it. Complete, like logical. I've got this. But then you're sitting on the exam, you're looking at the stuff word for word, like it was in your notes, and it's just something's not clicking. And so until we really try to teach it or get it out of our head, we don't really know. So you really need to understand this information on a level that you can teach it. And, you don't have to be able to teach it as in depth as maybe your professors can, but you should be able to teach it and be able to talk about this information. It's okay to use inanimate objects, friends, or family to study. It's even better to try to teach your teacher or your classmates if they're open to that. It's great to kind of bounce information off of someone who actually knows what the correct answer is. And, at this point, the last week before the exam, the best kind of questions to start talking through or going back and forth with are open-ended questions. Because you really want to focus on like the situations and scenarios, and not just because a multiple choice question that kind of tests like, hey, can you use strategies and stuff, versus like open-ended questions that really test, do you have the basic knowledge or the information you need to move forward? So working with others is really a key for success. And I found that a lot of the students that are usually more successful than others have a solid study group. And so a lot of people say, yeah, I really want that, but I don't know how to find that. And so if you need help finding it, please ask your professor, hey, do you know of any good study groups, or is there a way that you can connect some of us together? Or how could I meet other people? Or can I ask in class if anyone's looking for a study group or has a study group, maybe make an announcement in class, etc. So there's a lot of different options. And if you're wondering, like, why would I even want to go through this embarrassing process? Keep in mind, there's so many people in every class, and I've done this multiple semesters where people are like, oh, I want a study partner or whatever, and I'll announce in class. I even started a group me one time for some people where they could get together and study together, but all of them were too scared to say anything, and that's the hard thing. So but if you get together with people, like, someone else may understand something that's completely baffling you, and vice versa. Maybe you understand something and someone else is like, I don't get that. Then you teach them, and that just reinforces what you understand about that topic. And there's so many options to meet with people. We can do it virtually. You can do it online. You can do it before or after class. And I know everyone has hectic schedules and is really busy, but it's really good to get together in a group. And a group could be 2 people, but it's great when it's a few people bouncing ideas off of each other. And it's great to find multiple or different people, because the more people that you interact with, especially if it's people that think different than you, the more stuff that you can get in, because we learn the most from each other. I've attended, some, things that talked about how students learn, and they actually said, as much to my despair, as much as I'd like to be the one, that that students are always going to learn more from their we call it classmates than they ever will from their professor. So, keep in mind that this is like not only just like me just saying, hey, you need to find friends, it's really going to help you. And you don't have to love the people that you're with. It always helps. And I know I had some good friends in nursing school that we would just stay up late and laugh and have some crazy experiences. But, it's good to also commiserate and have someone else who really knows what you're going through. So if you need any help, know that most people are looking for a study group. So it's just about, asking and being willing to be a little vulnerable and uncomfortable to find, that connection. So another option you can do is what's called a brain dump. A brain dump is where you pick a topic, like a disease process, and without any notes, write down everything you know on a piece of paper. So you could do it with diabetes, or you could do it with one of the, if you're an adult, you could do it for one of the major like respiratory processes for that first test. And you write down everything you know about it. It's best done if you have it under a concept map. So it's kind of organized. It might have, hey, here's the patho, here's the assessment. But effectively, you're going to kind of organize it like your textbook. What is it? it, who gets it, what do you call it, how do we diagnose it, how do we monitor it, what assessments need to be done, et cetera, et cetera. And so kind of write that all out. And after you're done, compare with your notes, what sections are missing or are lacking information. So where are your gaps? Like that's at this point, the week before the exam, you really want to be filling in your gaps and finding out, hey, what do you call them? What am I missing here? You don't need to go back and reread and relearn all the information. If you're spending this last week just reading over your notes, I'm not saying it's not going to work because I do not know everything, but generally I find students that just look over notes over and over and over again on repeat. They're memorizing, they're not really applying. You need to just find your gaps and find those areas that maybe you don't know as well. And you can't know that until you get the information out of your head. So if you want to try something new, some other things to consider are doing one of the homework or write out worksheets. You can watch a video about a disease process that you're struggling with. You can do a different EAQ. You can write out notes if you haven't done that. And I'm not saying you need to do all of these things, by the way, but these are just some options if you're looking for some new things. Listening to a recorded lecture or YouTube. There's lots of great people that do good lectures on YouTube. Listening to or attending think tanks or watching a think tank recording, write out a concept map, draw a disease process, make a table to differentiate diseases, or use supplementary resources like Registered Nurse RN, nursing.com, or Simple Nursing. Those are some of the big ones that I've used in the past and that I found students have told me they found helpful. These are all just a variety of lists because sometimes we just need to get out of our comfort zone and do something completely different than what we've tried before. So what if you're lost with medications? I get this so much time. I'm bad with medications. Welcome to the world of nursing. So we all struggle. So there's some tests that are going to have more medications than others, but do not spend all your time on medications and do not miss out on other things. I see some students who say, oh, I'm so bad at medications. They spent all their time trying to memorize medications. And there's going to definitely be medication questions, but it's not going to be the entire exam. Do not try to study medications on their own. Try to incorporate them into situations and priorities. So like just knowing the names, like let's say that you're studying diabetes, just learning the insulins and their times, that's great. But what kind of situations are going to come up with those? Why do you need to know those times? How is that going to apply to a situation? Or let's say that, with the oral diabetes meds, like, okay, so some of them need to be given with food. Well, what kind of situations are going to come up? What kind of things could happen where I need to make a decision as a nurse about these medications? And then also thinking about how they're going to meet the patient's needs. So, for example, like for diuretics, we give diuretics to remove fluid. So, not just, I could sit here and say, hey, diuretics, they're given to take off fluid, but how is that going to help a heart failure patient? What goal is it going to meet for them? It's going to help them to breathe better. It's going to the goal of it is not for them to pee. I don't need them to pee. I want them to breathe better. I want them to be able to get up and walk around and tolerate activity better. So what am I trying to achieve for the patient by giving this med? Some questions that you might want to ask yourself about a medication is, how will it help a patient? What symptom or problem am I trying to relieve or prevent? Like I just brought up, how is it really going to help? What is at the core of it? What can it do to advance my patient's goals? Does anything need to be done before I give it, during administration or after? Is there any labs or assessments that need to be done before? Is there anything special I need to do during administration? And how about when I'm done? Then I want to know, how will I know it worked? And that's and I have to think about what I'm hoping for. So again, going back to that diuretic, I will know a diuretic worked if they're peeing a lot, that's great. But how will I know it worked for this patient? If it's a heart failure patient, I'm hoping for, clear lungs, or I'm hoping for decreased edema in their legs, hoping for improved activity tolerance. And so I really have to think about the disease processing question. And that's why I put here, I'm not talking about expected side effects, because, there's always expected side effects with things, but what is the actual purpose that I'm giving this med for this particular patient? And then I also want to know, how will I know there's a problem with the medication? And there's the two spectrums on there. I want to know, how will I know they had too much, like adverse effects, or how will I know they had not enough? Maybe the med's not working. And really focusing on the common and deadly when it comes to side effects. So an example of know that they've had too much versus not enough. Something as simple as blood pressure medicine. If they have too much, their blood pressure could drop super low. Or if it's a beta blocker, they could get really bad bradycardia. But if they had not enough, then they're still going to have that high blood pressure, and they're not going to be meeting their blood pressure goals. And this could be the same as insulin. Too much, they're going to become hypoglycemic. Not enough, they're going to still have that high blood sugar, and they could be having complications from that high blood sugar. So what if you're struggling to differentiate diseases? So I find tables are super helpful to break stuff down, writing out what makes the disease different, like the symptoms, who's at risk, complications, treatment role of the nurse, etc., really is helpful. Don't just write down everything you know about the disease, just focus on what's different. So, and I think I'm going to talk about this when I talk about breaking down notes, but sometimes, like, let's say you just made a whole bunch of notes and you're like, how do I make these different? Go through and star them or highlight the things that are different. So maybe you have these long 8 over 10 of notes, go in and highlight them or mark out. Okay, so I've learned about 4 or 5 different respiratory diseases. What makes each of these different? What stands out? What is different than all the other ones that I've learned? Really focus on just those differences, because at the end of the day, we can't give you a question with 2 things that are the same and expect the differences there. We're only going to put 2 things that are maybe similar but have little differences, and then just understanding those little differences, like for example, tuberculosis and pneumonia are both infections. Tuberculosis, I need antibiotics for months, 6 to 9 months, and then for for tuberculosis. Then pneumonia, I mean, I'm only going to need antibiotics maybe for a few weeks. So there's a difference. They both, if antibiotics, they have different antibiotics, and then they also the length of time that they need to be given. For pneumonia, there's no isolation. For tuberculosis, there's airborne isolation. So, kind of looking at those differences, both infection, but how are they different? And if you don't know if something is different, then you could watch a video. Usually very similar things. There's videos all over YouTube. Like, so if there's something that's very similar but a little different, like when we get into cardiovascular disease, we're talking about the difference between arterial disease and venous disease. When it comes to vasculature, there's a lot that are very similar, but if you look up and Google it, you can find a difference. So if you Google the name of the first thing versus the name of the second thing, nursing, you can find a lot of really good stuff. And then also you could put your notes side by side and just pinpoint, like I said, just mark out what looks different. What if you're struggling with labs or diagnostics? So flashcards are good for learning lab values or remembering names of things, but aside from that, you should not have long, complicated flashcards. These really aren't going to help you or do you do good in the long way, because in the long run, you're just memorizing again. And the only things we really need to memorize are maybe names. Like if you need to remember, oh, the normal potassium is this to this, like, okay, that's fine. You can use a flashcard for that. But if you're writing down everything, all the symptoms of potassium, high and low and everything, like that's just memorization. It's not really going to help you. You need a more practice situations. Keep in mind with labs and diagnostics, you don't need just to know the value. You need to know, what is the value telling you about the patient? So for example, I could sit there and have the normal hemoglobin A1C memorized, but if I don't know what it means when it's low or it's high, then that's not going to really help me, because most questions that we have on our exam are not knowledge questions. They're mostly going to be application questions. So I need to know, okay, here's this number. What does it mean for a patient with diabetes? So think about, how will your treatment or care differ because of this value? So if my hemoglobin A1C is high, how will that differ than when it's lower? You also want to think about, what actions are you going to need to take? So I have a blood glucose of 40. What do I need to do for a blood glucose of 40 versus a blood glucose of 400? There's a big difference there. Try to rewrite labs in your own words. Like if you write down the big fancy names and the big fancy definitions of all the labs and diagnostics, it's going to get really confusing. Make sure you're writing things in your own words as it makes sense to you. Specify if the lab is going to help you diagnose. Apparently, I was very tired when I made these PowerPoints. Diagnose a condition, or is it used to help monitor? So which end of the spectrum are we? And so, because some labs are going to be used to, like, say, hey, a patient has this. So, for example, an example of that would be, okay, in order to diagnose tuberculosis, I use a sputum culture. But in order to monitor it, I might monitor like a white blood cell count, or I might monitor a chest x-ray to see how they're doing. So what if you're someone who has long detailed notes? So maybe you're the opposite end where you've studied your little booty off these last couple weeks, and now you're like, okay, you said long detailed notes and memorization aren't helping, but that's all I have. So, if you spent a long time writing really intricate detailed notes and now feel like you have no time to memorize them because you spent so much time making them, don't fear. Long detailed notes are not usually the best use of our time, but it's not time wasted. You can do something with them now. To make them helpful, go back through and simplify the notes, summarize sections, like kind of take them and say, okay, this is a whole summarize it in just a sentence or a bullet point. You should not have long paragraphs or complicated tables, big fancy words you don't understand. You should have your own words and bullet points. Those are the best way to do notes. So you could go back and highlight in star key points. You may rewrite things. And I'm not saying go back and redo them, but I'm saying go back through the notes and just kind of simplify them, or, act like you had to break them down and you had to summarize each little part. How would you summarize it for you? And if you're not sure what the key parts are, think about what's common and then what's deadly, and focus on what makes this disease process different rather than memorizing every detail like I was talking about before. So other, kind of a little bit more in depth of how to shorten these notes. For the patho, focus on, trying to get a visualization of what's the overall picture of this patient. What's the big so what? So let's say you have a really long patho section where you talk about like, diabetes is a metabolic endocrine, blah, 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 like long thing. Okay, like what's the big so what? Who cares? Why do I have to learn about this disease? What's the impact on my nursing career? What's the impact on that patient? Under assessment findings, or also maybe under your symptoms, you should not have 15 symptoms. Focus on what's common and get a general picture of the patient. If there was a textbook patient that had, diabetes, pneumonia, tuberculosis, etc., what would they look like? Try to keep it 3 symptoms or less. And if you can't really keep it to 3 symptoms, think of an image, like 3 general descriptors. So like, for example, for tuberculosis, there's probably like 7 or 8 symptoms listed in the book, but they're, what do you call them? They're not hungry, so they're losing weight, so you could say like they're kind of like anorexic. They're they got the night sweat, so they're sweaty, and they can't breathe. So yeah, so like, kind of getting an image in my head of what does this patient look like, and things like that. So that's going to help me to differentiate. And you want to think about, what will help me to definitively know that a patient has this, because I could do, like, for a lot of the respiratory diseases, I could sit here and say all day long, hey, yeah, they all have, shortness of breath, but which ones are like, what's different about them? So I really want to pick out what symptoms are going to help me to say, okay, this has to be XYZ disease. If it helps, you can even draw the patient out to kind of get an image of them in your head. For the meds and treatments, think of what is common and what will be most helpful for this client. Don't just like write out a list of meds, group them how they will help. So for example, like think of some of the respiratory diseases that we have, like upper respiratory. So there's a lot of like allergic rhinitis meds, or sinusitis meds, etc. And so how could you group those? Hey, these are all the ones that will help prevent symptoms. They need to take them ahead of time. And then maybe you have another one that's like, hey, here's all the ones to help with symptoms, and really think about how they're going to help. Like, what symptom are they going to treat, or what are they going to do to help this patient to meet their goals? So you really want to, and you can kind of like circle them and group them together and say, hey, these are all the ones that will help with cough. These are the ones that will help to thin, secretions. These are the ones that will help to decrease, the runny nose, itchy, watery eyes, etc. Then under nursing interventions and teaching, do not just have a list of interventions, group them by how they will help, like pretty much like what does the, like, so when it comes to teaching, so real quick, let me back up. So with the grouping the interventions, you want to group in order, like, for what's going to make sense. So let's say I was talking about a heart failure patient. Maybe I have a group. Here's all the interventions that are going to help with their fluid problem, or their breathing problem. Hey, here's all the interventions to do with their nutrition. Hey, here's all the interventions to do with their, their heart or their cardiac output. Like, I'm going to kind of separate all of those. And other things to, consider is like, which of these, activities as you're starring or shortening your long notes. What does the client need to know to prevent complications? It's a big part of nursing, to want to prevent complications, keep the patient safe. So what are we going to do to help? Which of the things that you have in your long list, which of them is going to help prevent complications? And what's the big picture for how I need to care for the client? What in general am I trying to do? Am I trying to treat symptoms? Am I trying to, manage some major problem? Am I trying to monitor something or actively treat it? Like, what's the overall what I'm doing? So for example, for diabetes, I want to keep their blood sugar stable. I want to make sure that they don't have complication. I want them to avoid highs and lows, things like that. So that's just one example. So how do I bring it all together? So let's say that I've done this stuff, I've talked to other people, my notes are good, I've done some practice questions, I've done some reading, and now I really want to know, where am I at? And there's no definitive way. There's nothing you can do to study that you're going to feel you can feel 100% confident I've got this. And that's okay. It's not meant to be that way. This is meant to be hard for a reason. You guys are getting into a profession where everything's based on your ability to think and know when to ask for help. But it's really, instead of looking for activities that are going to make you feel good, like, a lot of times I think students think, hey, if I get a bunch of practice questions right, then I'll feel good about myself. But in reality, sometimes that's a false confidence. What really helps is to kind of set yourself up for success, knowing that you're doing all these things you can to learn about this information, to grow in it, to be able to teach it. And when you show up for that exam, that's the best way to be prepared, is to show up and do your part. Most learning, when you're actually learning, it doesn't feel like you're learning and you feel like you're failing, that you're not learning anything. So if you feel like you're not learning anything, you're probably learning something, because most of the students that I find that they feel really confident going in, a lot of times they don't do as well as they thought they would do, versus the students that feel very not confident, they tend to do better. I can't say why. So maybe ask yourself, have you done a practice exam? And so this is a good way to practice the stress of testing. I talk about this more in my test taking anxiety video, if you want to watch and learn about that. But put yourself in as much of a stressful testing environment as possible. Do 65 questions or so back to back. Do it in exam mode, not study mode, where you get immediate feedback, and time yourself, especially if time has been an issue for you. You get a minute and a half for each question. So time yourself and really see, are you able to keep up with that time? Because the worst thing is when you're getting the right answers, but you run out of time at the end of the exam. So when you're doing this, you're not really testing knowledge. You're not doing this again to see how many can I get right. You're practicing endurance, because some students, they can really know their stuff. They did everything, they're prepared, but then they're on question 35 and they're exhausted. Their brain is tired. So it's almost like you have to practice the endurance of doing a long exam like this. Because sometimes eventually you just get to a point where you're like, I'm done. I can't do any more questions. So you got to practice it. It's like running a marathon. A person doesn't wake up and say, hey, tomorrow I'm going to run a marathon. They train for it. So you got to train for these fun exams. Other ways to bring it together: utilize the reading questions. Go back to those reading questions and quiz yourself or your friends without your notes. And then anything, like any question you can't answer, just mark it and then go back and watch a video about it, look through your notes, try to, bring it back together, whatever you're missing. But again, just focus on your gaps. Don't go back and try to restudy everything. Take the course objectives and rephrase them as questions. I see a lot of students do this. This can be very helpful, and quiz yourself and your friends without your notes, fill in those gaps. There's cumulative worksheets on my Google Drive for each section. And this is for the adult med surg team. So if you're in a different class, I'm sorry, I do not have them for every class, but see what you can and cannot fill out. So you don't need to go in and completely fill out the entire worksheet. What I'm saying is go in and see which questions you can answer. If you can't answer them, that's your gaps, and you're trying to figure out, hey, what am I still missing? So general suggestions: text anxiety is real. Look at some of my other videos and strategies that I have on those. Do not study right before the exam, like the day or a couple hours before the exam. Give yourself a brain break, get outside, go for a walk, get some light exercise. Studies actually show that if you go up and walk around a little bit right before an exam, it can really help to get juices flowing in your brain. And so whatever you have been studying recently, it's going to help that it can actually connect and get stored so it doesn't get lost. It's the worst thing when you're sitting in the exam and you're like, I just had that. Make sure you're spreading out your activities and not studying for hours. Mix up what you're doing every 30 minutes to an hour so you're not killing yourself studying the same way constantly. Make sure you're taking breaks and remembering why you're doing all this painful stuff. That person that you love, make sure that you are, whatever your why is, just make sure that you're remembering that why, and make sure you're getting at least 6 hours of sleep. I know it's hard around the exam, and everyone's very overloaded right now, but just make sure that you're getting enough sleep, because if you're not sleeping, you're losing some of the beautiful brain cells that you would have with some sleep, especially at least the night before the exam. Get at least 6 hours. So that's my video over, how to get started the week before the exam. I know it was a lot of information, and I know you're like, oh my God, I don't have time to do all this. I haven't done any of this. That's okay. Just take some of these suggestions, and you're going to find with each exam, you can start incorporating some more of these. You can't do everything at once. It's not going to be perfect. Nursing school is about learning to be uncomfortable. And so just know that you're doing better than you realize you're doing, and keep moving forward and just start to slowly start incorporating some of these strategies. Try at least one new or different thing out of this, and you'll be in a good place. So I hope this helped. I'll see you in the next one.